Are you feeling tense, overworked, undervalued, maybe losing sleep, or feel like you might just be going crazy? I'm Dr. Anthony Collada. I'm a board-certified psychiatrist, and in this video, I'm going to talk to you about some common signs and symptoms of a mental health breakdown or mental health disorder. Now, sometimes mental breakdowns can occur when people are feeling overworked or overstressed, or just life throws curveballs that someone may not be ready to cope with or deal with. And it's not uncommon for things like this to occur. And sometimes with just a few months of the right treatment, things resolve and get back to normal. If not properly dealt with though, it could make it more likely that this happens in the future, and it tends to be more intense and last longer down the road. So a job loss, relationship breakup, drug use, or too much or too little stress can all be triggers of a mental breakdown. And these symptoms vary, but these can include emotional symptoms like sadness, depression, anxiety, anger, mood swings, maybe even disconnecting from reality. It can cause cognitive symptoms like racing thoughts, worries, hard to concentrate or focus, memory problems. It can cause behavioral changes like changes in sleep, isolating, changes in appetite or energy, perhaps engaging in more risky behaviors like sexual promiscuity or shopping sprees. Physical symptoms can occur at times, including headaches, muscle tension, upset stomach, shaking, changes in breathing, sweating. And again, risk factors for this include stress, trauma, drug use, maybe having a history of mental health conditions in oneself or family. Now, there's many ways to help with cope or deal with these, such as seeing a mental health professional or physician, therapy, support groups, crisis hotlines, or just going to an emergency room. Other ways to help include identifying emotions, mindfulness, DBT techniques, or others. And I have several videos of this stuff on my psychotherapy playlist. You can just click on the playlist and check out some of these videos for more details about different approaches, how to deal with mental health stress and stress management, things like that. Now, from my personal experience as a psychiatrist, I have seen several cases that sometimes can be consequences of the mental health disorder, or sometimes can be triggers of the mental breakdowns. But many people who follow the directions of their doctor and seek treatment will get better. So I think everyone goes through some period in their life where they may feel anxiety, sad, trouble sleeping, worried. Not all of it is going to require someone to see a doctor or a professional. I think it's important to be aware of, and definitely you should see a professional if you notice changes in your work performance, in your relationships, in your school performance, or you have really difficulty in your quality of life. For example, sometimes in relationship breakups, this can cause sadness or anxiety or mental health problems. But often over time, those will subside. One thing that can be good to gauge is those long-lasting, loving relationships that you have, like with your family or close friends. Are you treating them the same way, or do you tend to get more short or angry with them? Are you choosing to spend time with them, or do you rather want to isolate and not spend time with anyone? So those behavior changes could be signs that someone is going through a mental health disorder if those things change. Also, the longer it lasts, the more likely it'll be a mental health disorder. If it's just a few hours or a day or two, may not be that big of a deal, but if it lasts weeks or months, then it could be a little bit more concerning. Gauging how one is doing in their relationship is just one measure how to gauge mental health symptoms. Another measure could be school or work. Sometimes someone can measure the performance with their GPA. So you can ask if there's been significant changes in one's GPA during the time that this may have occurred. That could be a sign that it could be a mental health disorder or breakdown. Another area is work, such as maybe losing a job, being put on probation, having trouble finding a job, or even sending out application. These could be signs that whatever one is experiencing, like the mood swings, anxiety, emotional problems, cognitive problems, may be really impacting one's health. So there are several healthy ways to manage this, just like normal stress management techniques, eating healthy, exercising regularly, getting involved with the community. I talk about many of these approaches in the psychotherapy techniques. I also have a video about stress management that you can watch, and it gives you tips about how to deal with stress and ways to manage stress. Hopefully this video will help to break some of the stigma of what happens when people experience mental health breakdowns or need to seek care for mental health treatment. There are several resources available. Medications are one approach, therapy is one approach, but there's many options available, and it's not a one-size-fits-all. Each person is a different case, different life. Find the treatment and the approach that's best for you.